Hello, and a huge welcome to everybody today for our World Obesity Day 2025 lunchtime seminar. We've got hopefully a really good lineup for you today. So we'd like to start with an introduction from our fantastic PPIE leads, our public and patient involvement and engagement leads, Ken and Ali. After which, we've got Ali Walsh, who's going to take you through some fantastic new training resources that we've just developed. I've then pre-recorded a short introduction to our new animation, which we hope will be used across primary schools to address weight-related bullying and stigma. We've then got a short close from Ken, before we go into our question and answer session at the end. So there should be a good chunk of time at the end for plenty of questions and answers. So I'd encourage everybody to pop any questions that you've got into the chat, and we'll answer as many of them as we can at the end. And if there are any outstanding, we can put them onto our social media at the end. So without further ado, I would like to pass you over to Ken. And I should say, Ken and Ali have kindly pre-recorded their sessions because they're currently whizzing around Europe presenting on behalf of the European Coalition for People Living with Obesity. So over to Ken. Thank you.
Good morning, good afternoon, good evening, wherever you're watching this World Obesity Day webinar today. My name's Ken Clare. I'm the lead for Obesity Voices here in the Obesity Institute in Leeds, Beckett University in the north of England. I'm really looking forward to the programme that we put together for you today, and I'm going to hand you over now to my esteemed colleague, Alison Lake. Thanks, Alison.
Thank you, Ken. Hi. I work here with Ken at Leeds Beckett as part of the PPIE team, and today we've got a great programme for you. We're going to start with showing you a video that we've made about the impact of PPIE, and then you're going to go and see this amazing anti-bullying video that we've co-produced. Sorry, it's called Everybody Deserves Kindness. Then there's going to be a Q&A session, and then you're going to hear from Ken again with her closing remarks. So enjoy your time here. Thank you so much.
All right, good afternoon, everyone. I'm delighted to join the seminar this afternoon with the first of our two talks this afternoon. My name is Dr. Ali Welsh. I am a senior lecturer in physical activity and health sciences here at Leeds Beckett University. And I'm going to spend the next few minutes talking about the power of patient and public involvement and engagement. And I'm delighted to share with you the launch of our new patient and public involvement training videos designed for people with lived experience, researchers and practitioners. Engaging people with lived experience should really be at the heart of all our research. And I'm well aware that I might very well much be preaching to the converted as you guys are all here this afternoon. But this is something that myself, Louisa, and other colleagues today are incredibly passionate about. PPIE has the power to improve the quality and the relevance of the research that we undertake, underpinned by the voices of people who are likely to be affected by that research and thus then have a right to have a say within it. It has the power to empower people by giving them a platform to share their lived experiences, to share their insights, and hopefully directly influence any of the services, any of the policies, and the research that is likely to affect them. It has the power to address some of those inequalities that we're also well versed with by amplifying some of those underrepresented voices and actively involving people from more of those marginalized groups across our communities that can reflect their real world needs, priorities, break down any of those barriers and providing opportunities to co-design inclusive services, all while speaking a shared language and reaching people where they are. We're so lucky in the Obesity Institute and other areas of the university that we can share so many examples of PPIE in action, from understanding women's health needs by means of creative workshops, to co-designing exercise programs for people with stroke, to co-disseminating knowledge about healthy aging and informing education needs for health professionals. Yet PPIE in each of these contexts, all of those people that have been involved have different levels of experience, have different levels of knowledge, awareness of what it means to take part in PPIE activities. So either as a researcher, a practitioner, or that person with lived experience. So here in the Obesity Institute, we decided that it would be a useful tool to design, develop and film a three-part series that within the context of the Obesity Institute here at Leeds Beckett University would share what PPIE is, provide an overview of the research process and share ways in which people may wish to get involved. We hope that these videos have the capacity to boost involvement within research projects, such as idea inception, such as co-production and dissemination. We really think that having this bank of resources will make research much more approachable to the public, and we hope it will encourage wider engagement and really foster trust in that research process. From our perspective as researchers, we think that this might strengthen some of our research bids that we do, improve the high quality standardised training across the university too. And from a patient and public perspective, most importantly, it will really allow individuals to have a say in those innovative, person-centred advances across healthcare locally, nationally, and even internationally. So all of our videos have been designed with researchers, practitioners and people with lived experience in mind, and they were co-produced, written and filmed by people with lived experience, and you might even spot some of those familiar faces within the videos as well. They're accessible from the Obesity Institute website and they're hosted on YouTube, so you can view and access transcript, closed captions to increase that accessibility. On each of the slides now to follow, you'll have the opportunity to go ahead and scan the QR code, which will take you to each of the videos within this. PPIE is research that is carried out with or by members of the public rather than to or about them. Within this film, I have had the absolute pleasure of interviewing both Ken and Louisa, both experts in PPIE, and asking them what this good practice might look like. So at risk of any spoilers, they talk through a list of 6 essential do's and don'ts. No tokenism, be inclusive, ensure clear and respectful communication, prompt reimbursement, appropriate training, and evaluate and share learning. We hope that this video is useful to researchers in how to undertake PPIE and support those people with lived experience to easily engage in the process. So in our second video, the tables are turned and Ken, our lead for Obesity Voices at the Obesity Institute, asks myself as an active researcher some questions about the research process. So here I have the opportunity to talk through the 4 steps of the research process. So planning, doing, analysing and sharing in a simple, easy to understand and accessible format. So when we talk about planning, we share some ideas about how to understand what research needs to be undertaken and why is it important. And at this stage, and I suppose at all stages for your research, it is important to consider on deciding appropriate shared language and the best way to meet communities where they are at. Doing, this can involve lots of different methods, such as in looking at existing data in new ways, collecting new data, measuring certain things, or asking people questions. Analysing, this is around understanding what the data is telling us and sharing what we've learnt back to people who may be interested. This particular video we hope is useful to people with lived experience in introducing the steps involved in designing and developing a research project. We hope it gives them a little bit of a flavour of the types of activities that they might want to get involved in, which leads us nicely on to the third video in this initial series, how to get involved. In this particular video, I meet with Alison via Teams, and this is with a view to sort of demonstrate that PPIE can be accessible both in person and online virtually. It also represents that PPI activities can be undertaken in so many different ways, such as Teams, with geography being no barrier. So within this video, Alison talks us through the different ways in which people can get involved in the research at each of those 4 stages of the research process. For example, at the planning stage, people may want to take part in a workshop to share their experiences, suggest what their needs might be, what their priorities might be for them and their community. At the doing stage, people may wish to get involved with actual data collection, so getting their hands dirty, maybe supporting activities such as interviews. But do bear in mind that further and appropriate training might need to be completed if that is the case. At the analysing stage, people with lived experience can really help us researchers to make sense of the findings. So, for example, what does it mean to you as somebody living with obesity or with stroke or as a woman, you know, whatever group it is you're working with? How might those findings impact you and your family? And finally, sharing. This might involve helping research teams or practitioners write plain English summaries, writing a blog, making videos, taking part in podcasts. This video we hope will be useful to patients and the public in helping them to decide what types of activities they might wish to get involved in. They will often have the opportunity to do as much or as little as they wish. And similarly for researchers and practitioners, we hope that this will give them a little bit of inspiration as to what and when they can and perhaps should invite the public to contribute to their research projects. So you may be asking how you can actually use these videos. These videos are publicly and widely available, so please do access them, as I say, via the website using the QR code on the screen, and do share them as widely as possible amongst your channels and to whom may be useful. You might want to share them with patients and the public as a training tool to support them in understanding the research process and appreciate the different ways to get involved. You might want to share them with researchers to promote good practice for including people with lived experience in research, particularly following Louisa's do's and don'ts. You might also want to share them with practitioners or sort of local organisations to support them in adopting inclusive ways to work with communities to address local needs and priorities. This is all with a view to put the voice of lived experience at the heart of research, to empower those communities and prioritise their needs, ultimately improving the quality and the relevance of research. We do hope you enjoy watching them and we do hope that they are useful to you. Thank you for listening. I look forward to taking any questions about the PPIE training video series later on in the session. And I'm next going to hand over to Professor Louisa Ells, who has shared with us a short recording of a presentation that again can be used more widely around addressing weight stigma and bullying.
Hi, I'm Louisa Ells. I'm Professor of Obesity and Co-Director of the Obesity Institute here at Leeds Beckett University. And it is a great pleasure to speak to you today about an area I am hugely passionate about, and that is addressing weight stigma and related bullying. So I'd like to start by just asking you to take a look at these 2 young people. And I'll ask you, what might they have in common and what differences do you notice? I can tell you that they both share one thing in common, and that is they both live with a chronic disease. So Gemma here lives with asthma, and Nazia lives with obesity. The only difference is that Nazia can't hide her label. She has to wear her label every single day. Now, even though both of these diseases can be modified by lifestyle changes, it's only Nazia who is judged by the way she lives her life. Just because we know Nazia lives with obesity, does that really give us the right to cast judgment and blame? Absolutely not. So do you think headlines such as these are acceptable? Why I refuse to let my daughter be taught by a fat teacher. Heffalump traps will clear the NHS of fatties. Headlines which can be hugely, hugely damaging. However, sadly, this weight-related stigma isn't just limited to what we see and what we hear in the media. It occurs across society, from members of the public, across our schools, even our friends and family. Even the healthcare professionals who are here to help can hold stigmatizing and misinformed attitudes towards people living with obesity. And this is illustrated in a quote from a study undertaken in Bristol a few years ago now, where a mum recalls a recent GP appointment with her daughter, where he, the GP, said in front of her daughter, "God, she's obese. How on earth can you let her get that size? You know, you've simply got to cut down. You're giving her the wrong foods. Do you realise how much of a health issue this is? She shouldn't be that size." I'd just like to ask you, do you think this mum and her daughter would have received the same stigmatising and judgmental response from this same GP if she'd gone because her daughter was suffering from asthma triggered by the severe damp in their house? However, as I say, this is a relatively old study. It was published back in 2012, so well over a decade ago. Plenty of time for attitudes to have changed, right? Sadly not. This article was published just in the last couple of years in nhsmanagers.net, where the authors posed this question. Is overweight and obesity always just because of eating too much or taking insufficient exercise? Which they responded with, the answer is almost always yes. Whereas we know the correct answer is almost always no. We know that obesity is a highly complex chronic disease with over 100 different determinants, many of which are completely out of our individual control. And we know the impact of such stigmatization can be hugely damaging. We know that weight stigma is associated with numerous physical and psychological harms which can impact health and well-being and lead to healthcare avoidance and widening inequalities. And we know that this vicious circle of weight-related bullying and increased stigma associated with paediatric obesity can lead to poor self-esteem, depressive disorders, impaired school performance, decreased social involvement, which in turn can lead to an increase in the risk of developing eating disorders, unhealthy weight control behaviours, and further weight gain. This horrible, vicious cycle has got to stop. So this is why we had the great pleasure of working with the most awesome young people and families alongside colleagues from Leeds Teaching Hospital and the Shine service to co-develop a short film and some resources to help address weight-related bullying in primary school, with the key message being that no matter what your shape or size, everybody deserves kindness. So it's a great pleasure to be able to share this video with you today.
We are all different in many ways. Some of us wear glasses, some have curly hair, and some have different skin colours. Our bodies come in many shapes and sizes too, and that's perfectly okay. Sometimes people bully others by saying mean things about how they look. They might think it's a joke, but bullying can hurt a lot. Having a bigger body is not something you can blame someone for. Just like you can't blame someone for needing glasses or having a different hair colour. Body size, just like these other traits, is part of what makes people unique and special, and we should respect those differences. Everyone deserves kindness no matter what they look like. Being kind can stop bullying and make everyone feel better, even those who are being bullies. If someone is bullying you about your body or anything else, talk to a grown-up you trust. They can help you, just like with any other problem. Sometimes, people bully others because they are dealing with their own difficult feelings. Understanding why someone bullies is important in helping them change. We are all different, and that's something to celebrate. Let's be kind to each other and make sure everyone feels included and happy. Remember, everyone is special just the way they are. Let's make our school a place where everybody feels safe and happy.
So I really hope you find that a useful resource. It will be freely available to download from the Obesity Institute website, and we are currently working with some fantastic schools across Yorkshire to develop a teaching resource pack, which will be available hopefully very soon. So please do keep your eye out on our social media and our website. If you're interested in the teaching pack, or if you would like a copy sent to you as soon as it's available, you can email our Obesity Institute inbox and pre-register for a copy, and so it will be with you as soon as it's done. So that just leaves me to say a huge thank you for joining me today, and please do contact me if you have any further questions or queries. Thank you.
Hello, everybody. Thank you, Louisa. Thank you, Ali. Some really fantastic presentations there and demonstrating the amazing work that's been going on at the Institute. So we have had a few questions that have come in via email, which I've made a note of, but please do feel free if you have any questions, or we really value any feedback. So it might not be a question, it might just be a bit of feedback on what Ali's presented or some of the videos that Louisa has shown. It would be hugely appreciative. Thank you. Okay, so the first question, and this is from some school colleagues. They just want to double check, are these resources going to be available to everybody to use? And can you just clarify how everybody accesses them?
Yep, I can answer that. Most definitely, yes, they will be freely available for anybody to use, whether that be schools, youth clubs, families, whoever would like to use it. They should all be openly and freely available via the Obesity Institute website. And when the teaching resources, I will upload the short film that I pre-recorded if anyone finds that useful, perhaps for involved in staff training. I don't know if it's useful, please do use it. And the teaching resources should be ready in the next couple of months, and they will be uploaded there too. And please do email us using the Obesity Institute email address if you'd like to kind of pre-order your copy of the teaching resources. So yes, sorry, long answer to a short question.
No, that's really great. Thanks, Louisa. And I think we'd be, if people do use these resources in schools, we'd really value any feedback of how that has gone. So how did what was the children responses? What was your responses? Because we are continuing, which feeds perfectly into my next question. It was almost like I'd planned this. Again, this was from some colleagues from a school setting, and it's probably both of you might wish to answer. It's, are you planning on doing any more training videos?
I will go ahead first, Louisa, and then please do feel free to chip in. In short, yes, we are extremely keen to develop a further bank of resources for patient and public involvement and engagement. So in the first instance, we created these initial 3 videos to be launched today, very fitting for World Obesity Day, where we have these introductions into what it is, what can you do, and how can you get involved. In time, we would like to continue to co-produce resources that will focus on specific patient and public involvement and engagement activities. So, for example, data collection. So we know, for example, it could be really useful for someone with lived experience to support us in that data collection process, or maybe in that dissemination process. The list can go on. We're really open to suggestions as well about what you think the resources should include. So, for example, if amongst your organisation, amongst your research team, you think there is a gap in training provision for patients and the public, please feel free to share. We'll see what we can do in terms of creating some tools, some resources around all the different types of patient and public involvement.
Great. And do you want me to, from a anti-bullying and weight stigma perspective, I'm really pleased to say that we have just secured some funding to do another video, but within older children and adolescents. So I'm not sure whether that will be an animation. We very much want to be steered by our young people as to what that is going to look and feel like. So hopefully that will be prepared this summer, so we should be able to share that with you hopefully next World Obesity Day. And just, Claire, you did raise a really important point around evaluation, and there will be an evaluation form at the back of the teaching pack, because I think, you know, this is our first effort at this, and we really want to learn as we're going along and improve and continue to develop a suite of resources in order to address kind of what our communities need, basically. So yeah, really welcome that feedback and evaluation.
Wonderful, thank you. Again, next question fits seemingly in, and Ali, you might have your next topic for your next video here. So one of our participants, I'll read that because it's a comment and a question together. So there's lots of great advice here about how to combat bullying on campus or in a school. But what would you say is your best advice on fighting bullying on social media? There is often low to no control over what people comment, and the comments can often be very offensive. How do we fight or tackle this? How can we make it better for somebody else? So there may be a video idea in there, but also your views and thoughts are appreciated on that.
Yeah, absolutely. Thank you, Elizabeth, for sharing and asking your thoughts. Certainly a video could be quite useful in how to manage and, as you say, respond to some of those things to reduce the impact that they might have. I suppose it's around that education, the things that Louisa has been mentioning in those original sort of Everybody Deserves Kindness videos, and supporting young people with that. Social media adds a layer of complexity to it. And it's difficult to think off the top of my head some examples of how we can tackle that, but it's certainly something we can go away and think about, and perhaps intertwine that with some of the resources we're going to develop in the future.
And I think that's going to be a really important consideration for our teaching resource pack. I mean, I'd like to think not for our younger primary school children, although I do know that they are also affected by social media as well, but particularly when we develop the film and resources for our older secondary school age children, I think social media is going to be a key consideration. So working with our schools and young people to think about how best we can develop resources to empower young people to respond and to become resilient to that, I think is going to be really, really important. So a fantastic comment. Thank you.
Super, thank you. Another question that's been posted, again, a comment and a question, so I will read it. One of the participants said, I found it very upsetting and concerning that healthcare practitioners may use stigmatizing language such as "she is obese" in front of parents and their children. How does this, along with the misconception that obesity is solely a result of personal choices, affect the likelihood of individuals seeking healthcare support?
Well, thanks, Harry. That's a really poignant comment. I'd like to think that things are improving, because we know there is evidence to demonstrate that if somebody living with obesity has been stigmatized within a healthcare setting, which unfortunately too many of our patient lived experience members have reported, we know that can be associated with disengaging in healthcare support. So it's something I am hugely passionate about tackling. One of the other things we're hoping to do is to develop a resource library specifically around tackling weight stigma, sort of across all settings, but with a very strong focus within healthcare settings. And it's one of our missions within Leeds Beckett, is to ensure that all of our healthcare professional students receive stigma training and training around person first language and compassionate person-centered care, so we can ensure that we are educating the next generation of compassionate healthcare practitioners. So really, really important question. I think we're making great strides, but I think there's a lot more we can still do.
Louisa, I think you might have just suggested another idea for our training resources around developing compassionate practitioners too.
Yeah, I'm all for that.
Fantastic, thank you. A couple more questions have come in, so you're not seeing these on the chat, but they're coming through. So slight change of tact almost, but very, very relevant, and obviously your perceptions are of interest. What is so I think we all agree, and Ali, you said it, we're kind of, everyone on this call is here because they have a vested interest and understand the importance of PPIE. But what are some of the biggest challenges, and why are we still having these discussions, do we think? Why isn't it just kind of mainstream?
That's a really good question, and I think we're often asking that, and I think it comes back to meeting people where they are in their communities. We often have really good intentions. Our hearts are always in a really good place in terms of involving and inviting people to be involved within research. But universities are a scary place. Doctors, healthcare practitioners, students, equally scary individuals to somebody who may have never experienced that level of education before, or maybe have never been to a setting or a context such as that. So it's really coming back to breaking down those barriers and working with people in their community. A huge amount of work needs to go into building relationships and building rapport with the communities that we want to work with. Just by way of an example, for me, I've spent a huge amount of time hanging around organisations such as different strokes charities, such as the Stroke Association, spending my time at coffee mornings, on events, on days out, hanging around food banks to develop relationships with those communities, so that I have become sort of what I like to think as, I would hope, a trusted face, a trusted figure for people to want to come forward to support, share their story, and possibly be inspired to sort of make a change for the services that they are receiving. So if this was an opportunity to sort of give some advice, it would be to do that, spend time at coffee mornings with these charities, with these organisations, because the biggest barrier is that trust. And I think the second thing that comes with that is this challenge of practitioners, researchers, sort of coming in, doing this work and then leaving and not actually giving back and sharing back with the community what it is that they have done. And I know that Louisa, yourself, Claire, and the huge amount of work that the Obesity Institute does really tries to combat that by going back and sharing and developing some of those steps there. So yeah, the biggest barrier is the trust. The biggest barrier is having that sort of trusted figure. And the advice would be is to spend as much time, immerse yourself, make those cups of tea, spend that time there, and then really embed yourself within that community. I might have lost my way a little bit there, Claire. I do apologise, but I hope that answers your question.
I think, Ali, that's a great response. And I think I would just add that I think we just need to shout out about the huge, massive benefits of really good public and patient involvement and engagement. It is transformative in terms of the research we do, the services we develop, the policies we develop. It's a difference between kind of doing an interesting piece of research and then doing an interesting piece of research, which to me is hugely important. It is the actual piece of research that makes a difference to people's lives, actually answering questions that are important to people, to communities, to people that are developing and providing services. That is what gets me out of bed in the morning. And I think sharing the huge value of that massively valuable voice of lived experience, I think is more we can do.
Fantastic, thank you. And not at all, Ali, you didn't go off track. It was, and I love the enthusiasm of both of your body language. That would be fantastic. I guess a question from me, if I can do that. There aren't any other questions, so I'm not taking time away from anybody. A few ideas have cropped up through the chats or the comments around different stakeholder groups that you might target. So kind of the online, the compassionate training. From a pure research lens here, what do you, or who do you think are some of the key stakeholders that we really need to convince that PPIE is an integral part of the research process, and it's not a bolt-on that we do kind of right before submission? So who do you think are some of the key stakeholders, and how do we go about getting them on board?
Ali, do you want to go first?
Yeah, sure. So some of you that are present today may know that the work that I do from a research perspective is around supporting marginalised groups or underrepresented groups, particularly people living with neurological conditions, and more recently moving into sort of a women's health space from that perspective. So what we're seeing is people who are not necessarily embedded within healthcare services. They're often reliant on community organisations, they're reliant on the voluntary sector, and they're reliant on places and spaces such as libraries, possibly leisure centres if they are that way inclined. So I think for me, convincing those individuals who have significant roles of responsibilities within those voluntary organisations, and almost getting them on side, if you will, would be most important. So by way of an example, a recent project I've just been working on in women's health and the menopause, we have been working with stakeholders from a domestic abuse charity and also St Giles Trust, which has a food pantry, because we're wanting to really target those women who are perhaps on the edge of the justice system, who may not have experience of being within the healthcare system. And we're learning that that's because of lots of reasons, such as their mistrust and so on and so on. I'm dying to tell everyone about the findings, but I will, I'll persevere for now. So I think it's the voluntary groups, those community organisations, they're really the local groups that people might be reliant on.
And I think for me, and I know I do bang on about person-centred care all the time, but it's something I'm hugely passionate about, and it's about thinking about that person, that community, that population group that we're here to serve, and really thinking about who are the key stakeholders we need that are involved in that person's life, their social settings, their environment, and we need to make sure that we are getting all of those organisations and networks involved, so we have a joined up approach in to ensure that that person receives optimized care that is, tailored to their individual needs, and that person is empowered to make informed decisions about their care, so we can really sort of maximize the outcome.
Yeah, thank you. I mean, it was a difficult question because I guess there's no direct answer, is it? It's so well answered. Thank you both very much. There aren't any other questions which have come in through the chat or through other means. So I'd just like to take the opportunity to say thank you both to Ali and Louisa, and hope everybody on the call, you can hopefully see firsthand the impact the research that comes out of the Obesity Institute is having on people, on the lives of people living with obesity, because this approach is truly at the heart of absolutely everything we do from a research, teaching and knowledge exchange perspective. And some of the kind of videos that have been showcased today are just the tip of the iceberg for our ambitions in this field, in this area.
And if you want any more information, please don't hesitate to contact us. And if you're interested in getting involved, we've got our Obesity Voices Hub. Please do. There's links on the website in terms of what's involved and how to join. So please do contact us. And shall we leave the final closing words to Ken?
I was just one final thing. Apologies if people have been experienced sound difficulties. I think a few people. We will make sure when we share the recording that all the links to all the videos and everything is. So don't worry about searching around. We'll make sure you get everything that you need if there were any technical difficulties. Just a final thank you from me, and we'll hand over to Ken for our close. And thank you everyone for attending.